Okay, so how do we carry out a blood glucose curve? Well, the first thing is admission, and it's important to stick to a regular routine of the pet. So if they do have their food and insulin at 5:30 a.m, it's important not to stop this and say, well, bring the food and insulin and we'll do it here, because your glucose curve won't be true if it's not the true routine that the animal's used to. If they do have their food and insulin during clinic opening times, recommend them bringing it in with them, and often it's advantageous to take a pre-insulin reading and then feed and give the insulin with the client in the room, and the client stay in the room with them for a little while, because you do have a lot of cats and dogs that can get quite nervous and so don't eat, which obviously will effectively cancel the glucose curve. So prepare owners that they might be asked to stay in the clinic for sort of 15 to 20 minutes whilst their pet settles in and eats. If you can have a discharge as late as possible, that would be great, so we can have the full day to assess the curve. And also the curve will be assessed the next day with the vet. Please make owners aware of this before admission, because obviously owners want to know ASAP, but it takes quite a bit of time to assess a glucose curve appropriately, so the vets really need sort of a day at least to do this. Actually carrying out the curve itself, so recommendation is to carry it out every 2 hours. Some vets may want this to be done more often, but really it shouldn't require it unless they're really worried. How to actually take the sample. So blood can be taken from the ear, neck or leg. They can also be taken from the pad or from the elbow. The less restraint the better, because if you're restraining an animal every time to take a glucose sample, their glucose will be increased due to stress. So the less restraint would be best. Click, swab and apply Vaseline when needed in the area that you've chosen. The outside of the pinner is a really good area to go for. I would also recommend using the lancet machine provided with the AlphaTrack machine. It helps if you apply gentle pressure with the lancet machine, fire the lancet and then keep sustaining the pressure for a little bit longer. It really helps build a nice little droplet once you've applied the Vaseline, and you shouldn't need to have multiple jabs at it. What you shouldn't do is be squeezing the tissue to increase more blood flow to come out. And if you start sort of squeezing the area, it increases the plasma released, which in effect dilutes your blood sample. So try not to squeeze, or in fact I've heard people are picking off scabs to get blood from previous sites. That's a no-no as well. So if you've got a new AlphaTrack machine, just continue to use that with the recommended codes. If you've got an old AlphaTrack machine, for some reason these appear better for use with cats. With the new AlphaTrack sticks though on code 7, so not the code on the part, but that's only with the old AlphaTrack machine. If you've got the new AlphaTrack 2, just continue as it recommends. Cats must have free access to food as they normally do, and dogs should be walked every 3 hours so they can urinate. They obviously need free access to water throughout the day, and report any readings below 5.0 to a vet immediately. If you do get any quite random high or low readings that you don't really feel add up, make sure you retest. Complications that can occur. So dogs, the complication of Cushing's, the two diseases like to go hand in hand really. It's not every diabetic dog will have Cushing's though, but it's worth mentioning at the beginning this is a disease that can occur and can complicate the stabilisation of diabetes. So it's a secondary disease that we need controlling on its own to help control the diabetes. If your dog is not neutered, seasons can really affect the insulin, so they will need neutering as soon as possible. Urine tract infections, as previously said, the bacteria can again have an effect on the insulin, so we need to make sure that the dog is free of UTIs. And probably the most seen by owners is cataracts. Cataracts can occur really quite quickly in owners' eyes, and they can some owners report it's like they go blind overnight. Obviously this isn't the case, but they suddenly just lose the very last bit of sight quite quickly. This can be quite upsetting for owners, so it's really important they're pre-warned about this risk so it doesn't come as a shock. Where if diabetes is stabilised quickly, it can stave off the cataracts, but the majority of diabetic patients do end up getting cataracts, although they can have the specialist surgery to correct this if they've got insurance. Hypos is obviously the biggest threat to cats and dogs. They are in a state of hyperglycemia at the moment, so lots of people are concerned when they miss an insulin dose. My biggest concern is when they have an insulin dose that isn't required at that point. So if they don't eat and they have a full dose, because hypoglycemia is more of a threat because it's an immediate threat, because it affects the cells immediately, and they can go into fitting, go into a coma, and sometimes death. So hypos are the biggest warning that we need to give clients. Feline complications, including UTIs and hypos, but also remission. Make owners aware of the risk of remission and to keep a close eye on their cats within the first few months in case it seems like they no longer need the insulin but are being given it. So, a stabilisation consultation and maintenance consultation are very much the same, it's just a difference in how often they're carried out. MSD have a pet questionnaire which you are able to print off their website, or you can get the paper form if required, but the PDF is available from the website to be printed as and when required. So the questioning includes exact questions to the owner regarding dose, timings and the routine, diet, thirst, appetite, activity, general demeanour, pet's vision. Quite specific questions, probably because some of the answers the owners didn't really think about themselves until they're asked about it. For example, a lot of the problems that you can come across are just simply down to routine or owners doing something slightly incorrectly because they didn't realise they were. Again, this is record taking is really good at this point, so if they've got a diary to assess that, but also to keep a record of the answers to these questions. The examination, weight is really, really important. Also a body condition score to notice any muscle loss as well. Temperature, heart rate and respiration rate as per normal, and a nose to tail exam. Also a urine exam is very helpful. Although always expect glucose in a diabetic patient's urine, the thing we're checking for most is ketones. Stabilisation and maintenance consultations are carried out slightly different timings. So stabilisation is obviously quite frequently during that first period, every 1 to 3 weeks, depending on client compliance and depending on how the vet feels it's required. It's good to coincide with curves to save them making multiple trips. So when the animal is admitted, you can just build this into the admission consultation. And don't forget to charge for these. It's a service you're providing, and it's really important towards the treatment of the animal that we get that information. So just because they're not seeing a vet doesn't mean it's not really valuable. Maintenance consultations are the same principle, they're just carried out less frequently. It's every 3 months between vet exams, or more frequent if the vet's concerned at all. Pain curving is an ideal scenario. Animals can get really stressed in hospital, which can affect the results of curves. So if they've got the confidence and the ability to carry out at home, that's the ideal. The first thing is preparation, so making sure they've got everything they need, because it is quite a big feat for owners to do. So if they attempt it without all the equipment they need, they'll just get flustered and frightened and not want to try it again. So preparation is the key. So they need obviously their AlphaTrack machine. They might want to come in and have the sites clipped for them so they're ready to go and they haven't got to mess around trying to find a visible site every time. Make sure they've got enough sticks. They don't want to run out halfway through. And make sure they have an understanding of the timings that's expected from them. If they've got some cotton wool or some tissue, a little bit of spirit, Vaseline. They may also want to desensitise the pet. So this is with the Lancet machine. When it's set off, it makes quite a big click. If you've got a sensitive cat or dog and you're carrying out on their ear, they might not necessarily like that click. So a bit like fireworks, just get the owner to release the Lancet machine to make the noise sort of commonly over the couple of weeks before, especially close to the pet. And also make sure they've got some kind of records. I have clients that put it in a spreadsheet and email it to me, so make sure they know how they're going to get that information to you. So method, marginal ear, paw pad, or inner lip or elbow. Obviously inner lip can be a bit daunting for people, but the other three sites are quite easily accessible, so I would recommend them. Marginal ear is what we use in hospital. Paw pad is good as long as it's on the side of the paw, obviously not where someone they're going to tread on. And for dogs, is the callus on the elbow as well. So appropriate depth for the ear, you should only, on the Lancet machine, it goes up to a number of 4. You should only need it between 1 and 2 for an ear. Obviously for an elbow, calculus or a pad, you'll need 4, so it goes a bit deeper. Make sure the owner checks the code when they put the stick in first. And sometimes it helps to warm the area up a little bit, so just give the ear a little rub between your hands before applying the Vaseline. Put a pad in, if you're doing ear, put a pad underneath the ear, so a bit of cotton wool or something, just so, I mean, it can sometimes, the Lancet can, if it's on too deep, go through the ear and jab an owner, so make sure they have some kind of cushion between. Gently press the Lancet machine down, not really hard to squeeze the cells, but just to almost raise the vein in effect, and then fire, and then gently keep a small amount of pressure on just while the blood droplet builds. Then apply it to one side of the strip. You should only need to apply it to one side of the strip unless there's an error, and then just apply a bit of pressure on top just to stop the blood flow.